Good morning, good afternoon, good evening, depending on where you are joining us from. Welcome to today's AMR Community of Practice Echo session. My name is Sylvester Moyo, and I'm delighted to be your moderator for this session. Today's session will focus on AMR Surveillance Landscape Analysis Toolkit. This is a structured package of tools that are designed to help countries independently assess and strengthen their AMR surveillance systems. This toolkit supports evidence-based policymaking by combining landscape analysis and political economic analysis, stakeholder mapping, and systems costing, all aimed at improving the collection, the use, and the integration of AMR data across the One Health spectrum. Before we begin, I would like to highlight that today's presentation is also slightly different from some of our previous AMR CoP session. This discussion on Landscape Analysis Toolkit takes a more high-level systems perspective, looking at how AMR surveillance is shaped by policies, stakeholders, and also national planning. For many of us who work in the lab, it is important to see how the work you do in generating and reporting data feeds into these broader processes. I encourage you to listen with an open mind and think about how the lessons shared today can inform not only your work or research, but also how you support evidence-based policy decisions in your own countries. This is a chance to connect our day-to-day lab practice with the wider health system and policy environment. Also, before we begin, a few housekeeping notes. Please use the question and answer function for your questions. Also, you can feel free to use the chat box for your comments and reflections. Please also note that simultaneous interpretation is available in English, French, and Portuguese. So please select your preferred channel from the Zoom toolbar. Today's session is being recorded, and both the recording and the slides will be shared afterwards via the ASLM Academy portal. It is now my great pleasure to introduce today's presenter, John Farrow. John is a public health and health information systems expert with over 7 years of experience designing and implementing AMR surveillance systems across Africa and Asia. He specializes in data integration, DHIS2 system design, and developing dashboards and indicators that transform AMR data into actionable insights for decision makers. Currently, John supports the Fleming Fund's technical assistance for data and evidence use projects, leading country-level analysis, stakeholder engagement, and development of tools to strengthen AMR data use. He holds a bachelor's in health information science from the University of Victoria and a master's in public health from the London School of Hygiene and Tropical Medicine. Through his work with eSHIFT Partner Network, John has contributed to innovative surveillance tools and approaches that connect technical systems with policy needs, ensuring that AMR data informs both healthcare practice and policy making. We are very honored to have him with us today. John, over to you.
So thank you, everybody. My name is John Farrow. I'm a principal partner and health information systems expert with the eSHIFT Partner Network. And today we're going to be talking about the landscape analysis toolkit that we developed in collaboration with the African Society for Laboratory Medicine and the University of Zambia. And before we jump into it, I'll just go through a brief agenda for today. So we'll be starting with an introduction and a little bit of background about who we are at the eSHIFT Partner Network. And then we'll describe the scope for the Technical Assistance for Data and Evidence Use grant, the TADE grant, the scope specifically that eSHIFT was responsible for. We'll then introduce the landscape analysis and the thoughts that, the thinking that went into that piece of work, as well as the toolkit itself, the objectives and outcomes of this body of work, the methodology for the landscape analysis, the data analysis approaches, as well as a showcase of the tools that were developed alongside this piece of work. So who are we? eSHIFT Partner Network is a Swiss-based, based in Geneva. It's a nonprofit association that was founded in 2012 by a number of former WHO staff. And eSHIFT is very much focused on developing technology-driven solutions with, with the extensive global public health expertise that our partners bring to the table. Over the last 13 or 14 years, we've been entrusted by international organizations, including UN Ops, UNICEF, UNDP, the Global Fund, as well as WHO, among others, on both implementation work, but also on digital strategy work for low and middle income countries. We are an unaffiliated and neutral NGO, and have had successful national level technical implementations in low and middle income countries for digital health, health informatics, and national health systems. The approach that we take to our work is an agile one, in that we work at the kind of both the private and public side of things, and work to engage with international stakeholders, private stakeholders, public NGOs, governments, ministries of health, and form those partnerships that are required to lead successful implementations. So a little bit of background about our history in antimicrobial resistance. So starting in about 2018, the eSHIFT Partner Network was part of a collaboration with FIND, the Foundation for Innovative New Diagnostics, on a grant to develop and pilot an AMR surveillance platform in Zambia and Senegal. As a part of that project, that was under a GAMRIF grant, the Global AMR Innovation Fund from the UK. As a part of that project, we developed a set of custom tools to support AMR surveillance built within DHIS2, as well as open source interoperability tools and others, with very much a focus on lab connectivity and interoperability at the core of the project. Following on from that, FIND was the recipient of a Fleming Fund regional grant for laboratory quality management, networks, and data aggregation. And the scope of that project was really to enhance capability of national AMR reference and site laboratories, to improve AMR surveillance data collation, management, and presentation, as well as support clinical decision making. And as a part of that grant, we significantly improved the system that was built under the previous GAMRIF grant, strengthened the DHIS2 system, strengthened the various components of that system, and then implemented it in Nepal and Kenya. And that led to the development of what we called the AOS Health AMR surveillance platform, which was an integrated DHIS2 system for AMR surveillance, focused on the objective to address significant data management challenges, provide API integration, so automated integration to central data warehouses, and provide data visualizations and support glass reporting. So it was very much a digital system led to, to support the objectives of AMR surveillance. There's a little bit more about the timeline. As I said, started in 2018 and moving through those projects into support of Nepal and Kenya through 2024. So just a little bit of background just to show, where this all came from and, the effort that we've been undergoing over the last 7 or 8 years to get to this point. And under that AMR work, we were identified as candidates to support the technical assistance for data and evidence use grants for both Africa under ASLM and for Asia in collaboration with IVI, the International Vaccines Institute. And the scope for eSHIFT on the TADE grant was really much focused on providing technical expertise for the development and deployment of IT solutions, supporting data digitization and development of electronic solutions, developing tools for the collection, collation, and analysis of AMR data, and contribute to the development of economic case studies, support economics analyses on AMR, collaborate with policymakers, and to support trainings on AMR health economics. A lot of scope there, very much focused on the support of digital tools, which is part of what led into the development of this landscape analysis and assessment package that we'll be going through today. So a brief introduction on the landscape analysis. To support the objectives of the grant, the TADE grant identified the need to conduct a landscape analysis of AMR surveillance to support countries in developing a more structured and better understanding of the architecture of their AMR surveillance systems. There's a lot of moving parts, there's a lot of components, there's a lot of human resources and stakeholders and systems that are involved in running an AMR surveillance system. And the goal of that was to provide a package of tools and resources that countries can leverage to support their objectives in strengthening AMR surveillance. So as a result, we identified the following primary objectives for an initial pass at a landscape analysis, which what we undertook to map the existing AMR surveillance landscape in Zambia, Malawi, and Ghana, identify the key technologies, the data sources, and stakeholders across those One Health sectors, and really about understanding the political, economic, and social dynamics that shape AMR policymaking, implementation, and sustainability in these countries. And this led to the development of a set of tools that were designed to support countries in conducting, similar type of analyses to understand their landscape, and really with the hope of developing a body of knowledge in Africa as well as in Asia to some extent, to enable countries to share the successes, the challenges, and the efforts that have gone into developing their AMR surveillance systems. So the toolkit that we developed consists of the following components: a protocol document for the conducting of a landscape analysis of AMR surveillance. So that's the objectives, the scope, the methodology, the data collection mechanisms, etc. There is a AMR stakeholder mapping tool, which was developed by the University of Zambia, which I will be demonstrating shortly. There is the AMR SSAT, which is a surveillance system assessment tool, which I'll also be demonstrating. There is a user guide alongside that surveillance system tool. And then, of course, there is the costing tool that many of you may be aware of, which is a tool that was developed under a previous effort by the Fleming Fund, I believe in Uganda, that has since been improved and I think is being rolled out in a number of countries across the Africa region to develop a better understanding of the existing costs and the cost projections for managing an AMR surveillance system. And then finally, there is also a guidance document for leveraging existing resources for supporting AMR surveillance, which is in progress. So a little bit on the specific objectives of the landscape analysis project and the analysis itself. The first objective was to identify gaps in AMR surveillance and data utilization within the pilot countries, focusing on technological limitations, data collection challenges, and opportunities for cross-sectoral integration. We wanted to assess the roles, relationships, and influences of key stakeholders, including government agencies, healthcare providers, veterinary services, the private sector, and non-governmental organizations in shaping AMR policy and practice in the pilot countries. We wanted to develop a list of actionable recommendations for strengthening AMR surveillance systems and enhancing the use of AMR data in policymaking and decision-making processes within the pilot countries, as well as create replicable protocols and frameworks based on the findings from those pilot countries, enabling other Fleming Fund-supported African countries to conduct similar analyses independently, which is what brought us here to this toolkit and the package of protocols and tools that we're making available under this grant. And then finally, to leverage those findings from the landscape analysis to inform and design specific economic studies under the scope of the TADE grant, including case studies, burden of disease assessments, and investment case analysis. So a little bit about the expected outcomes. We wanted to generate insights that will, as I mentioned previously, lead directly to the development of standardized tools and methodologies, enabling us to support other countries in the region as they work to strengthen AMR surveillance systems, to promote data-driven policymaking, and develop sustainable responses to the AMR crisis. The findings from the landscape analysis will also serve as a foundation for economic analyses to better quantify the costs of AMR and develop investment cases for improved AMR surveillance and control. So all of that being said, we developed a primary research question, which was, how can the existing One Health AMR surveillance systems, data sharing practices, and the political, economic, and institutional dynamics in Zambia, Malawi, and Ghana be leveraged to improve AMR interventions, strengthen data utilization for evidence-based policymaking, and address systemic gaps in AMR surveillance and response? So the approach that we took consists of two primary components. There's the landscape analysis, which I have mentioned, as well as a political economy analysis, effectively a kind of light touch PEA that is, and this was all designed based on existing landscape analysis and PEA methodologies and frameworks. And the approach is to assess the current AMR surveillance systems, while the PEA will explore the political, economic, and social factors impacting AMR policy development interventions. And so both of those components are designed to gather qualitative insights through stakeholder engagement, data collection, and a structured analysis framework. And all to support, again, the following objective: to create replicable protocols and frameworks. So the methodology that we selected for the analysis was to conduct three different mechanisms for data collection for primary data collection from surveys. So the three were a literature review, a desk review to compile existing documents, such as, of course, national AMR action plans, studies, and AMR guidelines to provide context, a survey for primary data collection from the countries to get representatives from the in-country government entities, the country grant recipients, AMR coordinating committees, and other stakeholders, including labs and animal health and across the whole One Health spectrum, to capture qualitative and quantitative insights into current surveillance practices, data usage, and the challenges that those stakeholders face on a day-to-day basis. And following the literature review and the survey, the methodology includes facilitated workshops to bring together stakeholders to validate the findings from the literature review and the survey, to serve as platforms for collaborative discussion on opportunities to improve AMR surveillance systems, data sharing, and policy alignment across sectors. And then onto the political economy analysis. This was based on an existing methodology that includes 3 stages. So the first stage was to do a basic country analysis to assess effectively the boundaries of the AMR system, right? So assess the foundational political, economic, and public health contexts that shape AMR policies, and to develop a historical review of the political dynamics, funding, and public health priorities related to AMR. Stage 2 was to understand the organizations, the institutions, and actors, to map the roles and the relationships of key stakeholders within that AMR landscape, and to do that to basically defining the AMR sector by identifying major stakeholders, assessing their responsibilities, the data that they are owners of, the information systems that they operate and maintain and contribute to explore their motivations and incentives driving behavior, and to conduct a rapid assessment of those stakeholder dynamics. And then the third stage was to translate those findings into operational implications and actionable recommendations by identifying immediate goals based on findings and highlight areas of technical assistance and advocacy efforts to build awareness. There were a number of different data analysis components included, for example, thematic analysis based on survey responses, descriptive and comparative analysis from that survey response as well, gap analyses, power and influence mapping, economic incentive analyses, and mapping the various stakeholders to operational areas and interventions. I'm not going to go into too much more detail on the methodology because I think we need to get onto some of the other components. But the next tool that was developed by the University of Zambia is a AMR stakeholder mapping tool, which provides a structured approach for mapping and categorizing stakeholders in a country's antimicrobial resistant space using what's called a power and interest matrix. And that works by identifying key actors across the various sectors and assigning them a score on a number of different criteria that for the power that they hold within the sector, as well as how interested they are in engaging within the sector, right? So just briefly, the power is measured based on 6 different criteria, including the authority that they have, so the power to make decisions, the resource control that they maintain, the influence that they maintain over other stakeholders, the expertise level that they have in terms of whether they're recognized for having special skills or research capabilities, their ability to collaborate or maintain networks and alliances and partnerships within the space, as well as their ability to communicate. And then the level of interest is measured based on their involvement or concern in antimicrobial resistance. So the frequency in which of which they participate in activities and decision-making meetings, and the extent to which that participation, those stakeholders participate in those meetings. So frequency and extent. So how frequently are they in attendance of meetings, and how much do they participate in those meetings, right? And there are 2 different approaches to scoring those stakeholders based on these criteria by averaging individual scores. So you create a list of individuals or individuals who are conducting the assessment to score those stakeholders based on those criteria individually, and then you average those individual scores, or you basically hold a workshop to develop a consensus scoring system for each of those stakeholders. And the whole purpose of this exercise is to develop what's called a power and interest grid. So this is effectively just a visualization of the power of the stakeholder on the y-axis and the interest of those stakeholders on the x-axis. So any stakeholder that is in the lower left box, it maintains low power and low interest, so they're not as important as the rest of the stakeholders and have minimal effort. Versus the top right, are high power and high interest. They're key players, engage closely, and you need to make sure you're maintaining strong engagement with those partners, right? And the whole purpose of this is to help to understand how to engage within the AMR surveillance landscape. So through this project, we were able to conduct a survey using the methodology that we developed across the whole Africa region. In fact, we did not limit it to just the 3 countries, and managed to collect 118 responses from stakeholders across 9 countries. Unfortunately, due to time constraints and challenges with data collection, we were only able to conduct the formal analysis and reporting for Ghana. We're not going to be going through the results of that analysis today, but you can be assured that there is a general report covering the region that is in progress. And then following the development of the protocol and conducting the analysis for Ghana, it was decided that in order to maximize the utility and the usefulness of this effort, it was necessary to alongside the protocol document, develop a assessment tool that could support countries in conducting the kind of monitoring and evaluation of their surveillance systems aligned with the methodology that we developed. So I'm going to go through that in some detail now. That tool is developed in Excel, and it is based on the landscape analysis and PEA protocol, and also includes some additional features for longitudinal monitoring and evaluation of AMR surveillance programs. And this is really designed as a customizable M&E tool to enable countries to do some, longitudinal M&E over, a multi-year period so that you could maintain a solid understanding of the landscape and where things are improving, where things, need improvement, so that sort of thing. All right, so I'm just going to stop sharing here for a second and switch over to the tool. Hopeful that you guys can see this now.
Yes.
Perfect. Thank you, Sylvester. So this is the AMR surveillance system assessment tool. As I mentioned, it was developed in Excel, and it was really built to provide a framework for countries to independently assess and strengthen their AMR surveillance systems, stakeholder coordination, policy environments through landscape analysis, PEA, and general monitoring and evaluation. It includes on this homepage the research questions that I've already showed you, as well as just some information about the analysis itself. And then I'm just going to go through some of these tabs in order, just so that we can get an understanding of the capabilities and the way that this assessment tool is used. So if you go over to this profile and instructions tab, you can see there's a little bit of a data entry guide for what fields need to be entered and what fields have drop-down lists, and any fields that have calculations. So the first step in conducting the assessment is to fill out the assessment profile, including the country name, the region or province in the case of subnational assessments, the assessors, the stakeholder, the individual, the organization that is conducting the assessment, and the date that it is being conducted, as well as the status of the country national action plan, the starting year of the national action plan, and the ending year. So step 2 is to go through the data entry tabs. So there are 5 landscape analysis data entry tabs and 6 monitoring and evaluation data tabs. And then there's 3 visualization tabs that have the outputs from the data input. Okay. So I'm going to skip over the data analysis tabs and go straight to the data entry tabs. And if we come here to the stakeholder list, you can see it's fairly straightforward. So I've already got some sample data in here for you to be able to visualize this a little bit. So here, as you're going through this assessment, you enter the name of the stakeholders that are engaged within the the AMR surveillance landscape. For example, we've got Fleming Fund, Ministry of Health, WHO, national laboratories, etc. We've got the type of donor, so there's a drop-down list for what type of donor is involved, or what type of donor what type of stakeholder, excuse me, that stakeholder is, the sector in which they operate, whether it's One Health, human health, food, environment, or other, whether they maintain what's called decision-making authority, so do they have the ability to make policy decisions, whether they maintain a funding role, so do they fund other stakeholders, and how active are they within in engaging within the domain. So are they an active engagement in an active stakeholder, a passive stakeholder, or unknown? And based on some of those criteria, then an engagement category is calculated. So whether they're a strategic authority, a policy leader, a financial enabler, or just a general stakeholder. So the next tab here is the stakeholder entity relationship tab. And this one is quite cool in that it allows the development of what's called the stakeholder map. So if you go in here and you select the stakeholder, so this drop-down list is populated based on what you've added into the stakeholder list. And you can, select a stakeholder, or in the case of what's called an entity, either a system, for example, a DHIS2 surveillance system, or WHONet, or whatever. Or let's say you have a report that you want to include in that stakeholder list or the stakeholder map. You can then define the relationship that that stakeholder then has with either another stakeholder or an entity. So for example, in this example, the Fleming Fund partners with the World Health Organization. The Fleming Fund funds the Ministry of Health. FHI 360 implements DHIS2 for an example. Okay. So this, as you go through and you populate this and you try to articulate exactly what the relationship is between the stakeholders and the entities within your AMR surveillance system, you can then come over here to the stakeholder map page, and you can hit what's the generate stakeholder map button. And I've already done it. If you hit, it just basically pops up a window that says generated stakeholder map, and it'll create this visualization that takes those stakeholders and entities that you've input into the tool, and it'll automatically generate a visualization that populates the various stakeholders, as well as the artifacts, the entities or objects that you've included, and then shows the relationship between those stakeholders. So for example, the Global Fund monitors FHI 360. As I showed you, FHI 360 implements DHIS2, etc. So this allows you to develop an automated visualization of those stakeholders and the relationships that they maintain. And then going over to the surveillance systems sheet, this is where you can input information about the different software systems that are in place in the country, the sector in which they are used or for which they have data, the data types that are collected, and you can select multiple data types here in terms of animal information, consumption data, AST results, etc. The format of that data, the quality of that data, whether it's high, medium, or low quality, the completeness of that data, if it's fully complete, somewhat complete, not complete, etc. Whether there is full integration, whether that system is integrated with other systems, whether it's fully integrated, partial, or limited, who the funder is of that organization, who the owner is of that organization, who the funder is of that system, who the owner is of that system, and the maintenance frequency of that system, whether it's maintained monthly, quarterly, annually, less than annually, etc. The organization or stakeholder that is responsible for maintenance, whether it's maintained internally by the owner, by an external maintainer, or a vendor, or other, etc. The sustainability of that system in terms of whether it's sustainably funded or not in many cases, and the challenges that surveillance system maintains, whether it's lack of scalability, inadequate user support or training, inefficient or insufficient data visualization, etc. And this is also you can select multiple options here for what the challenges are, and this list is as well expandable. And then getting over to data collection and sharing, I'll kind of speed up here a bit. I think we're just in the interest of time. We've got types of data, the surveillance system, the owner, the data format, the data collection mechanism, the frequency of data use, frequency of data sharing mechanisms. I think you get the idea. There's a lot of different criteria that you can score different systems, different stakeholders, different types of data on within your architecture. And then we also get to the stakeholder power and influence mapping. So this is exactly what we had described previously with the power and interest grid that was designed by the University of Zambia. So you can basically you select your stakeholder, you assign them a score between 1 to 5 for the authority, resource control, influence, expertise, collaboration, communication, and then the interest scores as well. And then that'll calculate the score for those stakeholders. And then once you've gone through and you've input all of that information, you can come over to the landscape summary and visualize all of that data. So I realize that this is all just sample data, and I think it'll be a lot more useful once there's real information in there. But you've got the total number of stakeholders, the number with decision-making authority, the number of stakeholders with a funding role, and the percentage of stakeholders that are actively engaged. You've then got that exact power and interest grid that we had shown earlier. So seeing the high power, high interest stakeholders, high power, low interest, et cetera, and how they are mapped on this visualization, which I think is quite cool. And then you've got a lot of other types of visualizations in terms of breaking down the data by AMR stakeholders, stakeholder types, engagement category, the types of data that are collected, the number of systems, the format, the data quality, the data completeness, integration, maintenance frequency, etc. So you can go through and you can visualize all of that information that you've input automatically. It's all will populate automatically, including the barriers to data sharing and that kind of thing. And then we'll move over to the monitoring and evaluation component. So this was designed as a customizable M&E component for AMR surveillance systems. So we've got 6 different domains for which the system can be assessed for governance and coordination, laboratory capacity, data and IT systems, funding and sustainability, human resources and capacity building, as well as One Health integration. So within each of those domains, you've got a set of predefined indicators that we have developed for each of those, right? So you go through here and there's lots and lots of different indicators that you can measure your system against. I won't go through them in detail. But then against all of those indicators, you can input a response. So whether they are, fully implemented, mostly implemented, partially implemented, planned, etc. And that will give the indicator a score. You can then change the weight of an indicator. It's all by default set to 1. So if, for example, you think it's extremely important to have a national AMR surveillance strategy and roadmap that is formally approved, dated, and publicly available, you could increase the weighting of this to say 2 or 3 or 5 or however you want to weight that within the context of the tool. And you can also, for example, not implemented gives a 0, not assessed. So you can also decide that actually we don't want to assess that. We can select that as not assessed and it won't be included in the analysis. Okay. So we've done that for all of those different domains. And each of those is calculated automatically and gives a percentage score of 0 to 100. Right? And then this is done for laboratory capacity, for the data and IT systems, and we've got 80, somewhere between 60 and 100 indicators for each of those different components that are pre-populated, but also you can add your own, include things that we may have missed or things that are potentially not applicable to your context. You can decide to not measure, right? And again, for funding and sustainability, HR and capacity building, and then One Health integration. All right. And once you've gone through that assessment profile, that assessment of the various domains, you can come here to the assessment summary page, and you can then visualize those assessment scores, as well as the status of your national action plan. You've got the domain assessment radar visualization that shows you where you are, within that those 6 domains in terms of how well you're scoring as a system. The assessment statuses for governance and coordination in terms of where are things mostly fully implemented, where are things not implemented for across the 6 different domains. And again, a different visualization of implementation status by domain. Okay. And this at this point is still a work in progress. I think we've put a lot of effort into this, but we also look forward to some feedback. Once users and countries and stakeholders can get their hands on this, we're looking forward to receiving some feedback in terms of what could be improved, what other types of visualization could be added, and if there's any other information that should be included that we've missed. All right. Can everybody still hear me?
Yes, John, we can still hear you. We can still see the Excel sheet.
Perfect. All right. I'm just going to switch back over to the slide deck. I've got a couple more slides. So we've gone through the tool. Also, as a part of the landscape analysis toolkit is what you may already be aware of is the surveillance system costing tool. This is a tool that, as I mentioned previously, was designed under a previous Fleming grant to basically understand the costs associated with AMR surveillance systems. I'm not going to go into this tool in detail, but it's important to be aware of that it's also a component here. And then there's a number of other tools that are going to be included in that guidance document about various different resources that are important to be aware of. Many of you may already be aware of them, but I think it's important to use this as an opportunity to maintain these tools as something that is known within the domain. And there are several other resources that are useful in managing and conducting M&E for AMR surveillance programs. For example, there's the TRACS quadripartite country self-assessment survey, which I think many countries have already conducted. There's the CDC LARC system assessment, which is a structured assessment for antimicrobial resistance laboratory capacity. There's the FAO Atlas assessment tool for laboratories and surveillance systems, as well as PMP-AMR, which is a progressive management pathway for animal health, as well as the World Organization for Animal Health PVS pathway and PVS tool, which is a capacity building and strengthening a workflow for veterinary services. So there's a number of other components that are going to be included in that general report, but I think it's important to take an opportunity to call those out. As for the release of the toolkit, as I mentioned, there's the protocol document, which is, a framework for countries to conduct their own kind of landscape analysis for AMR surveillance. There is the stakeholder mapping tool, which, I highlighted by University of Zambia, as well as a component of that is included within the assessment tool. There's the assessment tool itself and the user guide. There's, of course, the costing tool, and then the guidance document for existing resources as well. And all of that is intended to be released by the end of Q4 of 2025. All right, I think we're coming up to about 45 minutes in, and we've got a good 15 minutes or so for questions. Thank you very much, everybody, for taking the time to listen to me today. I know it was quite technical and quite heavy on the spreadsheets and the indicators and the methodologies, but I appreciate you taking the time to listen today. Thank you.
Sure. Thank you very much, John, for that insightful presentation. I think you've highlighted how the landscape analysis toolkit really can be used not only just to map existing AMR surveillance systems, but also to identify the gaps that are there, understand the stakeholder dynamics that are there, and also to identify the opportunities for a much stronger cross-sectorial collaboration. So this is a very practical way, I think, that you've highlighted to try and connect the surveillance data with the policy and also the investment priorities across the country. So really, again, thank you for that and for highlighting the tool and also the other tools that have really contributed to this toolkit. With that said, we do have a couple of questions for you, John. So I will start off with a simpler question, then we'll work our way towards the much more maybe difficult questions. So there's a question from Boya, I hope I pronounced the name correctly, who says, can a well-designed DHIS2 system integrate sanitation indicators, alerts for uncovered zones, and infrastructure monitoring modules for both environmental and public health context? So I know this is for sure. If it's well designed, that's a yes, but I don't know if you'd like to speak more on that. Thanks.
I'd be happy to. I think you answered it already, but I think the answer is yes. I mean, it's all dependent on whether it's well architected, and you decide whether you're going to leverage the tracker side of DHIS2 or the aggregate side of DHIS2 for data capture, and whether you're going to include within tracker, whether you're tracking an entity or a sensor or something like that. And then for the aggregate side of things, are you just capturing aggregate data? I mean, I think the answer with DHIS2 is always yes. If it's well architected, you can do it, but the difficult part is doing the architecture.
Great. Thank you so much, John, for that. There's a question, interesting question from Isidoro Sunday. I think you've covered how complex, the mapping that goes behind these tools and trying to get as much information as possible. But the question from Isidoro Sunday is that can't all these assessment tools be condensed into one tool? He says they seem to be complicated. Can they be made short and simple? Yeah. I don't know your
I
thoughts,
mean,
Jordan.
I agree completely. I mean, I think that was part of the intention with this tool, was to provide a more simplified way of conducting, monitoring and evaluation of systems, of developing an understanding of the architecture and everything. I think this is about as simple as it gets when it comes to tools like this, unless you're designing something very specific for the program in which you're doing the evaluation of, right? So it's a pretty basic M&E tool that provides you some metrics, but the real power of something like this comes over longitudinal evaluation, right? Where you're conducting the assessment, not just once, but multiple times over a year, multi-year time frame. So you can see where things have changed, what has improved, what has maybe even grown, what has become a challenge, et cetera. It's really just a mechanism to quantify some of those things. But yeah, it doesn't get much more simple than this, unfortunately.
Yeah, as expected. No, thanks, John, for that response. So there is a question that was asked by Dr. Lucy Nyangao from Kenya. But maybe I'll just kind of partially answer it and then maybe hear from you, John, if there are any other responses. But also just to note, Dr. Lucy, on the screen right now, you have John's email. Please feel free to also reach out to him directly. So Dr. Lucy was asking that, with reference to the One Health approach, I think she was just mentioning that they're in the process of looking at a project that looks at fish farming. And so I think she sees the value of such a tool in terms of what they're trying to do, and was asking how they can get assistance with also trying to look at this tool and probably customize it for their context. So what I can say from our side is that as a regional grantee, as ASLM, we also work with other partners, just as John has mentioned. John is from eSHIFT, but specifically now coming to Kenya, we have been working closely with the in-country grantee, and that is ILRI. ILRI is the one that's really been supporting on the animal health side. So please, Dr. Lucy, you shared your email. We'll also make sure that, if possible, we also share the contacts from ILRI. And also then at regional level, from the animal health side, we also do have our colleagues from the AMRO project. So we will share those contacts as well. John, I don't know if you have any comments on that with relation to the animal health side.
No, I mean nothing specific other than, I think the intention with this tool is that it is meant as something that can be used for any kind of assessment. So if you want to use something like this to do some M&E for your program, then it is possible.
Great. Thanks a lot, John. So there's another question which I would like to also kind of like package a bit. There's a question from Daniel Kito Mutsia. His question is, how can one use this data to seek lab improvement support? But if you don't mind, John, can I just take it a bit higher so that it also covers his question?
Please.
So, from your experience, how do you see this toolkit helping countries be able to connect, the technical findings from the surveillance systems assessments that you mentioned? I'm glad that Ghana went ahead and said, no, we need to also consider a way of, doing some M&E on our system. But from your experience, how do you see this toolkit really helping countries to connect those technical findings from the assessments of their MR surveillance systems with the policy reforms and investment decisions at both the national and the regional level? Also answering, hopefully, Daniel's question. Thanks.
Sure. I mean, it's a fabulous question. I think the intention of this tool is to provide um, the framework and the support that countries may need to articulate more effectively the gaps, the barriers, the challenges that they have, and describe the successes in terms of what has been successful in terms of implementation, and what components, what areas of a system of their surveillance system have they struggled to implement, be it due to financial barriers or issues with sustainability or data or whatever, right? And the whole purpose of this tool is to provide a way to visualize and quantify those challenges, so that you can generate a report, you can generate some real insights that can be used to support advocacy efforts for additional funding, whether it's from governments, from donors, but really to show that the maturity is there in terms of maintaining a structured assessment methodology for your overall AMR surveillance program, right? So it's all about quantifying and then being able to visualize that information in a way that will support advocacy efforts. I hope that answers the question.
Yes, thank you so much, John, for that. Then there is a question that has been asked by both Daniel and our colleague Suleiman. They are asking, how can we get this tool? So just wondering if this tool is freely available for download for now, or is still part of, something that's under development and will be shared once it's kind of more fully developed. Thanks.
Yeah, thank you for asking that question. I think the answer is that it's not yet available, but the intention is to release it as a part of the toolkit, and to release it, publicly and freely, when it is available. As I mentioned in the presentation, the intention is to have it released by the end of this year. That's when the grant itself is complete, and we need to get these things out and that kind of thing. So. That being said, there may still be some improvements, after the end of the grant, and I'm certainly interested in making sure that there's the support there to make sure that this can be used. But just stay tuned. I'm sure there'll be information coming from ASLM, in terms of when this package will be released.
Great. Thank you so much, John, for that question. Then maybe just also, just looking at it, from your experience, just to kind of like learn from what you've done. You talk about stakeholder engagement and mapping. So, and the toolkit, I think the way you've taken us through the toolkit really emphasizes stakeholder mapping and the political economic analysis. From your experiences, what are some of the common challenges you've seen when engaging diverse actors, and how can countries overcome some of these challenges?
That's a very difficult question. I think, and that's going to be something that is you know, is something that will come through based on the results of this kind of analysis. As I mentioned, we did conduct this type of work for Ghana, um, and but I think speaking more broadly to my experience in the projects in which we've worked, a big of course, there's always the challenge of funding and sustainability. Um, the the systems that we operate, the programs that are being run, there is a lot of reliance on external donor funding, and especially given the current political and the realities around international development these days, um, funding through donors is getting harder and harder to come by, right? With the end of the Fleming Fund program, as well as other grant schemes and programs being shut down. I think the biggest challenge is going to be sustainability. And really, I think the success of these AMR programs is going to come down to advocating for domestic, domestic support, domestic financial support for these programs, advocating for the real, to show the impact of some of the programs that we are running, the AMR systems that are being, the labs that are being run, the surveillance programs that are being run, and how that information and how those programs are really making a difference in terms of addressing the emergence of resistance in these countries, right? So having tools like this to advocate and support your advocacy for funding, whether it comes from international donors or from domestic sources. I think that's kind of going to be the main approach to continuing with this important work.
Great. Thank you so much. I liked how you've also kind of touched on the sustainability part, considering the landscape, the financial landscape changes that have happened this year, and also that unfortunately, for this Fleming Fund project that has been supporting some of these initiatives, unfortunately, might be coming to an end in December. But uh, thanks for also just bringing that up to say there's a real need to also think along those lines. And just to also quote something that's coming from Justus Ashaba, who also just, has mentioned, and I think you've already answered this, John, who says maybe an additional component of the landscape analysis will be on insights on a listing of some of the decisions that have to be done, the stakeholders responsible for making such decisions, and that's exactly what this tool is trying to address. So, due to time, we will take note of all the unanswered questions and share them with John, and then we will share the responses as part of the resources that will be shared along with the slides and the recording of this webinar. John, thank you once again for your excellent presentation and for sharing how the landscape analysis tool can serve as a practical resource for countries to strengthen their MR surveillance system. I don't know if you have any final remarks from your side before we close.
No,
Or
other than to say thank you everybody for taking the time to hear this presentation today. I think it's been a very interesting exercise to go through the development of this, and I hope to hear from you again when you get your hands on these tools, just to provide any feedback that you may have, or even before its release, if you have any insights, any thoughts about how we could improve and make sure that this tool is useful and is has that utility that countries need. I'm looking forward to hearing any feedback that you guys have. But thank you very much. Thank you for your time. Have a good day, everybody.
Sure. Thank you so much, John. So please, before we close, just to remind everyone that the recording and the slides will be shared via email and the ASLM Academy platform. Again, if you've not yet registered to be a member of ASLM, we really encourage you to join via the membership link. You just go to aslm.org. And you'll find go to membership. You will find the details there. So this has really been an enriching session, and we look forward to seeing you at our upcoming AMR CoP webinars, where we continue to learn from experts like John and others, and also to share experiences on tackling AMR. Wishing you all a productive rest of the day and a blessed weekend ahead. Until next time, it's goodbye for now. Thank you.